Hi, my name is Nick Barber. I'm an oncologist in the state of Oregon, and I wanted to share with you some exciting news in regards to the benefit of exercise in people who have undergone treatment for cancer. So earlier in the spring, there was a paper that came out of a study that was done called the Challenge Trial. And what this study did was it took over 800 patients who had undergone treatment for either stage 3 or high risk stage 2 colon cancer. These are patients that undergo surgery followed by chemotherapy to help improve the chance of cure after surgery. It took these 800 patients and put half in a group of the usual care, which involves follow-up with labs, physical exam, and scans. And then the other group got the same thing, but they also got what we call a structured exercise program that lasted at least 3 years. So these are patients who had a consultant that helped them to establish a physical fitness program. Most of this was in establishing an aerobic exercise program. And it followed these patients over the course of about 8 years. And very interestingly and very significantly, it showed that there was about a 7% improvement in survival in the patients who were in the structured exercise program. So this is pretty significant. In the treatment of a variety of cancers, we oftentimes give treatments that can improve survival by 5%, 15%, 30%. And those usually involve some form of medicine or radiation, and those oftentimes have a lot of side effects associated with them. So to have an exercise program that is associated with an improvement in survival pretty similar to some toxic treatments is really pretty remarkable. So I think this should be taken as great encouragement for anyone who has undergone treatment specifically for colon cancer to really take advantage of an opportunity to get out and establish an exercise program, whether it be aerobic or we're learning much more about strength training and how that can have so many benefits. It can also make aerobic exercise much more enjoyable. So it should provide great encouragement to really get out there and establish an exercise program, and to know that this probably translates to other types of cancers beyond colon cancer. This particular study just looked at colon cancer patients, but I don't think there's any reason to believe how it wouldn't have a similar type effect in, say, breast cancer survivors or lung cancer survivors or survivors of blood cancers. So in light of that exciting data, I really encourage you all, especially those of you who have undergone treatment for cancer, to really get out there, have fun, establish a consistent and enjoyable exercise program. It will not only help you to feel better, but it could also improve your likelihood of cure. So have a great day, and thanks for watching.